You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, sedation dentistry. You no longer have to be afraid of the dentist. If you don't like your smile, you can now do something about it. With us, we have two experts on this topic, Dr. Garcia and Dr. Klein. Welcome to the program.
Thank you for having us on, Randy.
Thank you for coming on the show. Now, we've had you on the show before, and big topic. And, you know, we should mention Smile Texas. I mean, you're pretty much the go-to people in Texas. People travel from all over the country to go to your all over the world. Is that right?
Yeah, it's absolutely the case, Randy. We attract patients from all over the world that have a multitude of dental problems that travel to Houston to have their dental problems fixed.
Okay, so you hear it all the time. People don't like going to the dentist. I mean, do they still say that?
Absolutely.
You hear it every day?
They hate going to the dentist.
Yes, they don't like. They hate.
They hate it. Do they say that to you, though?
They hate it.
You hear it every day?
They don't hate the dentist. They have many patients have had bad experiences in the past.
Well, how do they say it though? Like you're on the consult. What do they say?
And they think we're the worst mouth that they've ever seen, and they're embarrassed about that.
Okay, is that right?
And by using sedation dentistry, we can take their anxiety and fears of having the dentistry done and turn it into a very positive experience for these people.
You guys don't look like dentists to me, by the way.
Well, thank you.
Well, thank you.
Friendlier, I guess, than most dentists. But so let's begin then with a little bit about sedation dentistry. So who is the typical sedation patient?
Well, the typical sedation patient is someone who has avoided the dentist for a period of time because they're afraid to go to the dentist. Maybe they've had a bad experience as a child. They typically will take their kids in, but they don't go. And
like how many years? Like 5 years without the dentist? A couple of years?
5, 10, 15 years.
Really?
Could be longer.
20 plus, some of those cases. And the longer they wait, the worse their mouths get, and the more afraid they are of going to the dentist because they think it's going to take either a long time to do things, or it's going to hurt a lot to get it done. And that's what sedation dentistry allows us to do, is fix these complicated cases in a straightforward manner, where it doesn't take a lot of appointments, and where they are so relaxed they actually don't even remember what we were doing.
That's hard to believe. They don't remember the procedure.
No, they don't.
Really? Yeah. So somebody gives them a ride home.
Yes.
Always have a ride.
They look in the mirror and they say, "Boy, I look different." What is it?
Typically,
teeth,
they wake up and they see their new smile and they're like, "Wow, I was at the dentist, I guess."
Is that right? Now it's a pill.
Well, there's different forms.
And okay.
There's nitrous oxide, which most offices have. Laughing gas. We can do a pill, which is one level of sedation. We also, in our office, offer IV sedation with a medical anesthesiologist, which is a deeper type of sedation. And
is that common though? Somebody that wanted to be, get IV sedation? We see it weekly, monthly.
It is in our office.
Every week.
Yeah, half of my practice is IV.
They want to be completely
sedation.
out.
They want to be comfortably relaxed.
Okay.
And then the patients that want to be even more relaxed, we bring in an anesthesiologist to help us get them in an even deeper type of sedation. So they're very comfortable and very safe.
Okay, do you think that the assumption, I mean, it was on my part, that just about every dentist is doing sedation? Do you need special certificates or licensing to do this?
Most states require special training and certification to be able to provide that. And most dentists are doing the pill type of sedation or the laughing gas type of sedation, but very few do IV sedation like we offer in our office.
Okay, let's take a look at some of these cases. We talked on the phone. I said we got to get you back in here for another interview.
Right.
You said I want to talk more about sedation because it brings more people in that otherwise would never come in. Yeah. And I was surprised to hear that. So let's take a look at some of the photos. What would you bring?
Sure. I'd like to talk about Bob, because Bob is a classic sedation case. He had put off going to the dentist for many, many years, and it actually was Bob's wife, Pat, that said, "You've got to have something done about this." He was withdrawing from society. He had lost his confidence. And his problem was the gag reflex. We eased his fears, and he was just very comfortable.
Looks like a great smile.
He had all upper teeth were removed. He's got implants that completely restore his upper jaw. We kept some of his own natural teeth in the lower and supplemented with implants where he didn't have his own natural teeth, and he's got a dynamite smile.
Okay.
Now Bob has got a great personality, and now his personality shines. Okay, Bob. Anybody in the room will know Bob is in the room now. Okay.
So he didn't smile before.
Didn't smile
Did they
before.
tell you that? Do they say, I just haven't smiled, or just maybe his wife told you?
And well, he's a very successful man, but that was definitely affecting his career. Because he didn't smile, people didn't think he was a friendly person. And Bob is one of the nicest guys you'll ever meet.
And I think his wife was also pointing out the bad breath, you know.
The bad
That was
breath
scaring
is
a
also
lot of people.
Also a side issue on this.
Because of what? Because of the
Gum disease.
Gum
Gum
disease?
disease.
Infections, yeah.
All right, all right. Okay, so show me another one.
Here's a gentleman, good-looking guy, NBA ref, a lot of tooth problems. Gum disease, loose teeth, and we've got a huge timeline. He's got to have a lot of dentistry done quickly to get ready for the upcoming basketball season.
All
and we
right.
only had a few weeks to do this, and he lives out here in California in Sacramento. So we were able to clean up the gum disease, place implants to restore the missing teeth, and give him a dynamite smile. So when you look at his after, you can see that's
very
a
nice.
heck of a difference here.
Doesn't look like the same guy.
Not the same guy. So before he had to worry every time he put the whistle in his mouth if he was going to have teeth coming out.
So they were loose.
They were loose.
So they had to go.
They
is
had to
what you're
go.
saying. Okay.
We used dental implants on his top jaw, and we restored his good teeth on his lower jaw, gave him some beautiful cosmetic dentistry, and now it's literally changed his life. He's confident again, and his career is just taking off the charts right now.
Okay, so sedation got him in the door.
Sedation
So he was just afraid
a
of the
huge
dentist.
factor. It kept him away.
I'm saying this so much, by the way, because I'm very, not skeptical, but surprised that people really put it off. But I guess this is what you guys hear every day.
I mean, why would a good-looking guy walk around with a smile like this if there wasn't some fear
Interesting.
or anxiety in the back of his head somewhere? It just doesn't. It's not congruent with how he takes care of himself.
Let's take a look at some of your photos there.
Okay. This is Carlos. He's a businessman from Mexico. He was referred in by a family member we'd also done a smile makeover for. And he was concerned about his smile because his teeth were starting to wear to the point where they started to get paper thin in the front. He was getting spaces between his front teeth. And he's such a nice guy, and he's so bubbly in person that his smile, you know, just didn't fit his personality anymore, and he started to become withdrawn. So he came in to see us, and flying in from Mexico, he was concerned about how long it would take for us to help him out. In 2 visits, we were able to give him, you know, the smile that he deserves.
So he was sedated too.
He was sedated, and he had light sedation, and this is the smile that we gave Carlos.
Very nice.
And
Huge difference. I mean, he looks
Yeah.
more successful.
And with porcelain veneers and crowns, we restored his smile. You see, he doesn't have these thin, worn teeth like he had before. And you know, he's a happy guy now, and he's confident. You know, and he's in the people business. It's important for him to be able to put himself out and be comfortable with how he looks and how he, you know, presents to other people.
Okay, Dr. Klein, you know, we were talking on the phone. You said at another point that sedation dentistry, everybody's in a hurry. This allows you to do multiple procedures all in one shot. Expand on that.
Multiple procedures. We can
Multiple
clean up
procedures.
gum disease. We can do tooth extractions. We can place implants. We can do root canals, all in one visit.
Veneers, crowns, bridges, you name it.
Okay.
Let me show you another piece. What we have here is a particular patient that, beautiful young lady, missing some teeth, and that was devastating to her. It just really eroded her confidence in her smile. So we were able to place dental implants, do some cosmetic dentistry, and as you can see, she's absolutely gorgeous here.
Very nice.
Absolutely gorgeous. I mean, you see her on the street and you'd think she was a model.
So those are porcelain veneers.
Porcelain veneers across the front teeth, and then over here we use dental implants to replace the missing teeth. And virtually undetectable from her own natural teeth. I mean, these results are amazing, and this is life transforming for somebody her age.
Here's another patient. This is Nikki. She just got engaged. She was thrilled, but she wasn't thrilled about having to take her wedding pictures with her smile.
Interesting. Do a lot of people do something for an occasion? Getting married, daughters getting married?
They do,
reunions?
and a lot of times because they're fearful of the dentist, they unfortunately wait until like the very last minute to get it done. In our office, we can still help them because we are able to get their work done in as little as 2 visits, so you know we can meet almost any tight deadline. Anyhow, she had dark teeth, the outer covering of her teeth, the enamel.
You can't just bleach those?
You could, but you'd still have, you know, problems with the gum. She had a gummy smile. You know, she had cavities. You can't bleach out the cavities. So we really need to go in and do a revamp, not just for the color or the look of the teeth, but they were unhealthy. She had problems with cavities and gum disease. And as you can see in the after picture, I mean, she's got a beautiful smile.
Very
And
nice.
this is a bride that's going to be proud to have her portrait taken, you know? Randy, here's another guy that came to our office. He comes from out of state. And he has been going to his local dentist, and he became frustrated because he was not getting a solution that he wanted that made his smile look better. He got so frustrated with that he thought he actually couldn't be helped. And the other thing was he was also afraid of getting a lot of work done, which he knew he needed, because he thought it would hurt and it would take, he had been told it would take many, many appointments to complete
Now,
his
that's not a
treatment.
good looking smile. Is that rare, by the way, you see things like that?
It's not unusual for us in the office, but in everyday life, you don't see them because these people don't smile. So you won't know them if they walk right by you.
So with him, what'd you do?
Well, with him, we cleaned up his gum disease, we cleaned up his cavities, and using porcelain veneers and crowns, we gave him a beautiful smile. I mean, he's happy to smile. He's not hiding his mouth with his hand anymore, and he's willing to go out and talk to people and get up close and not worry about his breath or how his smile looks. And he's a happy guy.